knees start to do a little bit of wobble, right? So it's trying to come which way? Towards me, right? Come on back up. And go again slowly. Get rid of your kidney slope there. Keep that foot dorsiflex for me. So go ahead. Keep the knees slightly flexed when you're standing on, and just she's okay there, and go a little faster. And you come up there, and right about here, that knee starts to shake a little bit on us. So it's trying to come in towards me, and she's trying to fix it. Okay, come on back up. So remember, where does TFL sit? On the anterior side of the iliac crest, right? So when I stand up, my TFL is of normal length. What happens when I do this? I shorten the TFL. Okay, so once again, I take the TFL and I put it way down here in the leg tension.
Dorsiflex, we don't want lazy ankles, okay? So you always want to try and keep the ankles dorsiflex, and then you're just going to come and then kick that heel up to the sky. Okay? You can obviously tell my hamstrings are very tight. So, being a runner, cyclist, my legs have very bad flexibility. So, those are all the very important cues, okay? So we have them lay down flat on the ground, arms down to the side, bring that knee to 90, grab behind that leg, drive that heel down into the ground, and we'll say, okay, why are you doing that? Why are you having them drive that heel to the ground? Okay, and we'll say, oh, well, that's to activate the glute. And what does that do? That helps to stabilize the pelvis, so that when I go and kick that leg straight, see how my back wants to roll? Okay, that's just something the body naturally does. Okay, so that helps to make sure that that doesn't occur. All right? Okay, for this stretch, I need a stick and I need this ball. Okay? So what you're going to have your partner do when you come in is they're going to put their foot on the ball. And a very important thing is you want to have them start this stretch with it not being active, right? So we don't want to start the stretch in a stretch, right? So we're going to make sure that your partner starts the stretch with their butt sitting back on their heel. Okay, so this is the relaxed position. I'd like you to do it in a different order than what's actually on here, because Dr. Lin likes to also do another exercise with these two stretches that he calls the worm walk. So we're going to do soleus first, and then walk out into the gastroc stretch. Okay, so our soleus stretch, that's a single joint muscle, right? And then our gastroc is a two joint muscle. Okay, so for soleus, we have the person start in this, what Dr. Lin calls our sprint start position. Okay, so we have to go on the one foot, and then we have to bend down, hands down on the ground, and then toe on the back of the ankle to force the back of the foot down onto the ground. Okay? So knee bend, this is our soleus stretch right here. Okay? So we just have the person basically stand or sit here and just hold it. Okay? So what's important about when you are doing your practical, some cues that you want to give to the person that is going to be your partner, is when they're in this position, you want to make sure that they're using this toe on the back of the heel to drive the heel that's on the ground of the foot that, or the calf that you're stretching, the sole that you're stretching. You want to drive that heel into the ground and try and keep that into the ground. Okay? And also, you want to make sure, so right now I'm stretching my right. I want to make sure my knee is not valgously collapsing or moving all over the place. It should be right over the toe. Okay? So right over the toe. So you have them hold this. This is soleus. You have them walk out. Straight leg. And that's gastroc. Same thing. Drive that heel into the ground. Okay? So straight leg gastroc. Bent knee. Soleus. Now, typically people who are fast twitch athletes will have a very tight gastroc, and people who are endurance athletes will have a really tight soleus. Okay? So the worm walk, which is actually a really good warm-up that you can have people do, is start So another thing that's important, obviously that's a difficult position to maintain a neutral spine in, right? So you want to try and at least just minimize it. Okay, so if you have somebody that's out in this position and they're kind of like this, you want to have them try and walk out a little bit more and try and flatten the back out the best they can. Okay? All right. Pretty simple stretch. That's all there is to it. Sprint start position. Okay, foot down, bend that knee. This toe on the back of this heel, hands down on the ground, knee over the toe. Okay, make sure it's not wobbling all over the place. So I'm not like out here or over here. Okay, right over the toe. Then we have them walk their hands out. Try and keep as straight of a spine as you can. Straight leg is our gastroc stretch. Okay? So a question that we potentially might ask you is, what motion do these muscles do at the ankle? Good, plantar flexion. Okay? So it's ankle dorsiflexion stretch, but these muscles are responsible for plantar flexion at the ankle. Okay? So that would be a question that we potentially might ask. Now, if you come in and you're really nervous and you forget to tell the person to keep their knee over their toe, don't worry, stuff like that is not necessarily a huge point deduction, but we might potentially ask a question like, if your client is doing this exercise, what is something you want to look for? What do you want to make sure they maintain? And hopefully that will spark, you want to make sure they keep the knee right over the toe. Okay? That's a pretty simple one. If you get that one at the practical, it's a good one to get because it's not real complicated. So, does anybody have questions?
Then what you're going to tell them to do is I want to tell you to get into a Y position. Your arms are going to be up over your head. You're going to be in the Y type position. One really key cue that you want to give people is you want to tell them to get in the Fonzie position. You guys know who Fonzie is? A, right? Yeah, A. So you got to externally rotate your shoulders as much as you can and turn your thumbs up. More. There you go. So you want to externally rotate as much as you can, turning your thumbs up. Keep your head down. Okay. All right, good. So now what you want to do, a lot of people can't distinguish between retraction and elevation. So you got to really make sure that you keep your upper traps relaxed. You want to feel the upper traps and make sure they're nice and relaxed. And then you're going to tell them, okay, what I want you to do is you're going to squeeze right here, pull your shoulder blades together, and lift your arms about an inch off the ground or 2 inches off the ground. Good. Relax those upper traps. Relax here. Good. Okay, that's better. Externally rotate. I want you to pull your scapula towards the midline, lift your arms off the ground. Not that far, just a little, just about an inch. Good. Relax your upper traps. So the two main things you want to tell people are to externally rotate and relax the upper traps, and then pull the scapula towards the midline, lifting your arms slightly off the ground, a couple inches. Okay, she's already moved into a T position.
Oh.
Okay, so you want to start in a Y position, hold for 3-4 seconds or so, and relax. And now T. And hold, and relax. Good. Now W, elbows right to your side. Is that a W? That's like a dolphin. W. There you go. Okay. Externally rotate the thumbs as much as you can. Okay, good. And now what I want you to do is keep the upper traps relaxed. Yeah, keep your head down. That's good. Get out of the way. Okay, good. Now I want you to lift your forearms off the ground just an inch by pulling your scapula together. Good. Well done. So it has to be a really small motion. Hold for 3-4 seconds and relax. Go back to the T. T. Or sorry, Y. Sorry, start at Y. Externally rotate. Upper traps are relaxed. Hold for 3-4 seconds. Relax, relax. Relax. No, relax. Shoulders down. There you go. Whew, this is tough work, huh?
Ow,
T's.
relaxing.
Yeah, she's very upper trap dominant. We got to work on it. So go to T now. Out to the side. Pull those scapula together. Hold. And relax. W, elbows right in your side. Externally rotate those thumbs as much as you can, and just pull your forearms off the ground about an inch. Your hands are like, rotate, get into the Fonzie position, and then really avoid upward trap activation. And it's a really small motion, so if I'm in a T position, I just want to pull my scapula together and my arms are going to move like that much. If I pull my scapula, it's only going to be that much. I want to avoid doing too much extension of my shoulder. So don't move through the shoulder joint because that's going to get too much range of motion. You just want a little scapular retraction, holding together. I should feel all those little muscles between the scapula and the spine. The adductors or the retractors. Yes? Okay, so once she's in a push-up position, we want to make sure that her spine is neutral. So we're going to put a stick on there and make sure that it's touching 3 places. Get your head back against it. There we go. It should be touching her sacrum, her thoracic spine, and her head. So head, thoracic spine, and sacrum. There should be a space in her cervical lordotic curvature and a space in her lumbar lordotic curvature. Once it's touching those 3 places, I'm going to get her to do a regular push-up. Put your head back against it. Regular push-up. Go for it. And up. And at the end of the regular push-up, I want you to get a little taller by pushing the scapula away from the midline. So get taller, but there you go. Okay. So what happened there? See, she rounded through her thoracic spine and she didn't move through there. Okay, so come back down. Try one more time. So keep all those touching. Do a push-up. And at the end, I want you to do a little protraction. Push that scapula. That's better. Get your head back against the stick. Good. So it's just a little pop with the shoulders, where she gets a little taller. Push up. There you go. Good. Exactly. So you see the scapula just move laterally slightly. Okay, push up. So the main push up, and then the plus part is that little pop at the end. Good. You really want to have the stick here to avoid going into hyperkyphosis. Relax for a second. What you can do is you want to change how much gravity she has to fight. So right here, she's horizontal to the ground. She has to fight 100% of gravity. So what you want to do is put her on a little bit of an angle so that it's a little easier. So I want you to come over here. Just for a second. Put your hands on the edge of the desk here. And your feet are going to be back there. So you're going to be like doing a push-up on the edge of the desk. And your feet right back. Good. Okay, perfect. So same thing, head back. Good. Now do your push-up. And up. And they'll end. Pop. Good. She's still doing a little bit of thoracic rounding. So we don't want to have excessive thoracic kyphosis. Paris Hilton now? Okay. No Paris Hilton either. Okay. So all I want you to do, it's a really small motion, just practice it there. Just try to get taller with pushing your scapula away. That's good. Good. And down. Good. And again. Pop. Perfect. It's a really small range of motion. Okay? One more time. Push up. And up. Get your head back against the stick.
Oh, shoot.
And plus. Good. And see how that stayed touching? If she didn't poke her head, she would have stuck it on her head there. Good.